Next up is Dr. Laura Snell. Dr. Snell is a plastic and reconstructive surgeon specializing in microsurgery and oncologic breast reconstruction. She's currently the division head of plastic and reconstructive surgery at Sunnybrook Health Sciences Center. Together with her Sunnybrook partner, Dr. Joan Lipa, Dr. Snell established the Sunnybrook Breast Reconstruction Program at the Louise Temerty Breast Center in 2011. Her presentation is titled, After the Initial Reconstruction. Welcome, Dr. Snell.
Okay, so I'm following some wonderful talks here, and I'm sure by now everyone's confused as to how their journey is going to go. And I'm going to confuse you a little bit more, but I'll try to keep it simple. So after the initial reconstruction, what is possible? Just to make it clear, the reconstructive journey, while it's different for every patient, I do tell every patient it takes about a year, sometimes longer, depending on the plot twist or what you encounter during your journey. Even for the direct implant reconstructions, or when we try to get everything done in one shot, there are often little refinements, little revisions, things that we can do later that again make this journey take a long time. So when you meet your plastic surgeon or your reconstructive surgeon, you will get to know them very well, because we stick with you during that year, that 2 years, or all those plot twists. We're there to help guide you through that entire journey. So we have a good relationship with our patients, and it's a journey we take together. The beginning is the first step, which is creating the breast mound. And that's sort of like creating the foundation of a building. You know, whether you're having immediate reconstruction or delayed reconstruction, whether your breast is going to be made of your own tissue, whether it's made of a tissue expander or an implant, you're creating a mound that's going to be the foundation for your future breast reconstruction, which may be 1, 2, 3, 4, 5 stages, however many stages you end up going through in this journey. So this is a different book than what Jennifer alluded to. This is the book that I think a lot of us remember maybe from when we're kids, but also again, when we're going through this breast reconstruction journey and we have our breast mound and maybe we've had a revision and it's time for nipple reconstruction. And at this point, you really don't want to keep going back to the hospital. But sometimes you can sort of take a little break and come back to the reconstruction journey, or you just keep going along until you're finished. But many people go through this period where they just don't want to keep coming, but it will end at some point. Especially for unilateral reconstructions, there's often a need to do balancing procedures, as was alluded to earlier. So for example, this patient had a unilateral mastectomy, which was nipple sparing, and a DIEP flap reconstruction, and then a later balancing breast reduction. And it's probably hard to tell at the end of the journey which side had what, but this took a couple of stages to get to. This is another patient who the before pictures on the left, before her bilateral mastectomies, which were not nipple sparing. And then after bilateral DIEP flap, she ended up having nipple reconstruction. And that took a couple of stages to get to that result. And same with this patient who had a skin sparing mastectomy on the right side, or sorry, nipple sparing mastectomy on the right side, and a balancing augmentation on the left side. And again, it took a couple of stages to get her as balanced as we could in the end. So what does come after that first sort of foundational procedure? Well, there could be touch-ups. So potentially scar revisions, mound revisions, meaning little adjustments to shapes or contours of your breast mound. There may be fat grafting sessions that Dr. Brown alluded to, which I'll talk about more in a second, but that kind of helps sometimes to adjust the sort of contour or the upper part of the breast or the side of the breast and just make it softer or shaped a little bit better. Maybe you need a balancing procedure, and this is particularly important for women that are having unilateral reconstructions or unilateral mastectomies or sometimes lumpectomies, and you need a balancing procedure on the remaining breast on the other side to help balance your two breasts. This may involve, again, a breast reduction of the remaining breast side. It may require an augmentation if your reconstructed breast is larger than it used to be. It may require a lift if you have a lower nipple on one side than the other. And then you may finish off with a nipple reconstruction, which may also come with an areola or a tattoo reconstruction. So touch-ups, for example, could entail fat grafting. So I can't go through all of the different touch-ups, reductions, augmentations today, because that would take about 3 hours. But focusing just on this one part of a touch-up, you may have, if like this woman had bilateral direct implant nipple sparing mastectomies with one-stage reconstruction, but in the end, she found when she was sort of pointing to the side or facing the side, she had a little bit of hollowing in the upper part of the breast, wanted to touch that up with injecting fat into that area. Same with this patient who I had marked in the surgery for her fat grafting, the second stage of her direct implant reconstruction, where she had some hollowing in the cleavage area, and we were able to inject that area with fat to improve the contour of that part of her breast. Balancing procedures can be done in women who have had unilateral mastectomies and reconstruction, or as in this patient who had a right lumpectomy and had some asymmetry afterwards. And so we did a balancing breast reduction on the left side to improve balance, and that was done a long time after her lumpectomy. And then this other patient who had a unilateral nipple-sparing mastectomy with an implant reconstruction and ended up having a balancing augmentation on the other side to try to improve the symmetry. Nipple reconstruction is usually sort of the final stage of the breast reconstruction journey. We call that Nipple Fridays at Sunnybrook. We do this under local anesthetic. We have music playing. A lot of women are really happy and proud to get to that stage of their journey. This would be an example of a nipple reconstruction before the areolar tattooing, where this woman had bilateral Dieppe flaps, and then we did a local flap to create a nipple mound, again under local, and then would have her come back for a tattoo. This is another example of a tattoo in progress. So in the larger photo, you can see a woman who had a reduction on the right side and a Dieppe flap on the left side, and had the first part of her 3D nipple tattooing and was waiting for the second stage to add some more pink color. At the top left, you can see at the initial part of the tattooing, what it looks like when they come to nipple day and have the first part of the tattoo and the pigment placed. And then at the bottom, you can see a final result of what a 3D tattoo would look like if you had it done with us. So in summary, this is a journey. We help guide you through this, whether it takes a year, 3 years, however many stages. There's a lot of different touch-ups that we can do as you go along, and they are all covered by OHIP, which is a really common question that I get asked. So thank you.